All right, so we're at noon right now, and some other folks may be joining us as we go along. Kind of a small group. Hopefully, Dr. Fala will be able to join us. So this is a recap meeting, and to learn more, to discuss more about what happened during the session and what you would like to happen going forward and what your interests are. So we appreciate your involvement and your interest in our series. And just as a reminder, this was funded, oh goodness. So Dr. Scott just sent a text saying that she's having a little trouble getting in. And I can, so if someone could contact her, and she's welcome to join me in my office if she's having trouble. And so once again, this was funded by a grant from the AHRQ to come up with a research agenda. I mean, we have a lot of ideas about what we might want to do. And so maybe today we can get a bit more focused on what we would like to do. So happy to see you joining us. So as a disclosure, I have no interest to disclose. And our planning committee, I would like to thank Dr. Fala and Dr. Scott and the graduate research assistants for all the work they did behind the scenes. There was a lot of coordinating happening. And so they've been very busy. Also, Michael Kurilla, who will be moving on to another university, but he's been very helpful with keeping up our website. And of course, our IT folks who have been very helpful throughout the series. And as you know, the Appalachian region is broad and diverse. I think people have kind of a preconceived mindset of what Appalachia is, but not all of Appalachia is rural, medically underserved. So there are urban centers, there are university towns like us here in Morgantown, but we tend to be surrounded by serving a population which has lower socioeconomic status, healthcare professional shortages, which we are dealing with, trying to help provide services throughout the state. Also concerns about broadband, which makes telegenetics a little bit challenging for our population. But it is a very diverse area. And so trying to figure out the best way to work with all these different populations can be challenging. And so I appreciate everyone's thoughts so far. As a reminder of our aims, we looked at current models of genetic service delivery in rural Appalachian region, focusing on West Virginia University, also University of Kentucky and University of Pittsburgh. We have some other folks who are in the Appalachian region who have also been contributing or are also serving the Appalachian area and Appalachian states. We talked about some potential resources for genetic service delivery, including NIMAC, who NIMAC is also having their presentation at the same time today. So they're having their in-person meeting. So unfortunately, they won't be able to join us today, but we will have this recorded and they can review it at a later time. And we will also get more feedback from them. And we've been working with the NIMAC group and West Virginia, and they also have been studying our state in a different way, but also talking about some ways of improving care delivery in our state. And our final aim was to form a list of priorities for research. And that's what hopefully we can come up with some ideas today. We'll go back through some of the information that we've received so far. And we thank Dr. Graves, who's joined us for her information from Georgetown University. It's been, this is our 7th month, I guess, that we've been at this. And so we appreciate all of our speakers, Justine, Margaret, Shannon, Julia, Alyssa, and also Dr. Cronk and Dr. Graves, who've been so such good supporters of this work, and in the trenches out there working with the populations and trying to figure out new ways to improve services to our medically underserved areas, particularly in our region. So I thought I would give a little bit of background of our registrants, which was interesting to me, to let you know a little bit more about who's been participating. So as of March 25th, we had 144 participants, and that's what the most of my review will be about. But I've been informed that we've had one more person to register. So we're always happy to have people to register and have a look at our previous recordings and transcripts. So in terms of education level, we were very skewed in terms of people with professional degrees and doctorates, but we also had folks who had lower levels of education, maybe not as diverse as would be ideal, but I think we are getting some good input from folks. But we also have a lot of different types of professionals included: genetic counselors, nurses, public health, dietetics, a JD, nursing as well, and a PharmD. So we've had a fair bit of different types of healthcare professionals involved. So this is my attempt at a heat map, and unfortunately I wasn't able to include the cities, but the majority of our participants are in West Virginia, New York, Pennsylvania, and Kentucky. And so they're very integral and working in the central part of Appalachia for the most part. But we also had a lot of engagement from the Northeast and also some from the West. I would have liked to maybe been able to reach some of the other states in the South, but we're happy that other people have been interested in what we're doing. And I suspect that this may be reflective of genetic counselors that may be more concentrated in the Northeast. So again, we see that our people trained in genetic services, there was a fair bit of variability there. Some had none, some had a little, some had moderate, and about half had very much, which also means that we've had a lot of participation from our providers in the region. So again, this just talks a little bit more. We have researchers as well, folks like me who are interested in genetic service provision and improving genetic service provision. Other identities, which I was pleased to see, we had quality assurance folks, technology, industry, policy program people, administrators, social workers, lab directors, students, and navigators. So it's a pretty diverse group of folks who have registered. Most of the folks were interested in adult onset disorders. I think there's a lot of work to be done there, especially in our region where we have a lot of chronic disease in our communities, and that there may be some hereditary component to that. But again, prenatal, pediatric also represented. And I enjoyed hearing more from prenatal and pediatric because it's an area where I'm not as involved anymore, but is still very vital and important to health service delivery. And I would say that pediatrics is probably doing a fair bit of outreach in our communities. Types of insurances accepted, not as much Indian Health and CHIP, that may be just by nature of where folks are practicing, we don't have as many Native American populations that are federally identified that are in our region. Also, CHIP would be more geared toward children. Barriers and challenges. So in terms of baseline barriers, frequently mentioned barriers included lack of genetic professionals, lack of reimbursement, provider education, and frequently mentioned barriers also include lack of awareness, access, affordability, and cost. So this is that again. And then the primary challenges in terms of the sites, what they mentioned in the talks. So WVU talked about improving patient access to genetic services, improving physician knowledge and referrals. University of Kentucky, recruiting and retaining providers, which is, I think these are all issues across the board, but things that they've been most especially concerned about. Expanding methods of care provision. Also UPMC, cost barriers, access barriers. And it was interesting, you know, I think parking is a big issue for people that are coming from rural areas. I mean, Morgantown itself may seem like a small town, but it can be very overwhelming for people from rural areas who are not familiar with the area and trying to navigate. We don't charge parking here, but some of the other more urban areas need to do that just to be able to manage their parking. So those are some challenges for folks from rural areas. Promoting patient and provider awareness that services exist and focusing on telegenetics, thinking about IT availability and literacy. So not only is it just general literacy that people have to have, they also need health literacy, genetics literacy, and technology literacy. So there's multiple literacies that we need to consider. So NIMAC, some of the things that were mentioned were distance to care, genetics care access, and more providers, and they've really been working in that area. And education about genetics and health literacy. And I think from one of our recent meetings, one of the things that came out is that we should probably be looking more at our providers in our areas to see what their level of awareness is. And Duquesne mention was made about accessibility again and genetics literacy. And our speaker from Georgetown mentioned number and location of genetic counselors, remote genetic counseling and testing, and lack of awareness as some issues. So if anyone would like to chime in, and I'd appreciate anyone's speaking up. Do these represent the challenges and barriers in the Appalachian region that you're aware of? Or have you seen other things that you're concerned about? Everyone is shy today. All right, well, I guess we've covered most of the things. And if other people have other thoughts, we'll be asking an evaluation at the end to provide more feedback to us. But I think these kind of get at the heart of some of the issues that a lot of our practicing clinicians and our patients are experiencing. So opportunities and resources available. So baseline resources, frequently mentioned resources include educational efforts that people are really doing a lot of work in this area. Telehealth as one way of reaching folks. Knowledgeable healthcare providers that we've really had some champions that are invested in this issue and really want to help us. Affordable testing, that there are ways of making testing more affordable. And we have to seek those out sometimes. They're not always obvious to us, but we don't want that to discourage folks. Support from parents and the government as well, that we have some resources available. Networks, like collaborations with academic institutions and organizations, and there were some specifically suggested. Also, other resources, including institutional buy-in, which I think we've all been working on in our institutions that may not prioritize genetics. Rapport with the public. Again, we've had some great patient champions for us that have advocated for themselves and for health service delivery, and we appreciate that. State programs that are in place to help with affordability. Models of care, thinking of different ways of providing services that can be compensated and at a lower expense for patients. And also registries that we have in our area that can help to link families. So other opportunities noted from our discussions, WVU talked about quality improvement efforts, and Dr. Fala has been involved in a project with NIMAC to try and improve follow-up with patients who are seen via telegenetics to get them to return their testing kits, which has been a challenge for remote folks. And I think Dr. Graves also mentioned that as well. More providers, reaching out, not only trying to recruit more providers, but also working with people who are not traditionally trained in genetics, that they can learn more about genetics and care provision in that way. And also working with websites and media. And that's something that we can probably do a better job of. It's not something that I do a lot of, but there are those opportunities that come up, and we need to be taking more advantage of those. University of Kentucky mentioned outreach clinics that they're engaged in, and I think that's, before telegenetics, that was really the way that we reached our rural patients who couldn't come in to the clinic and who had to travel for hours just to get to us. Also, the growth of multidisciplinary clinics where a genetic service professional can be engaged with a lot of other providers and provide input into care. That's especially important for pediatric patients. Patient informational materials, so they've developed some, but having culturally appropriate materials, it is an important area. And one thing that they mentioned was training the next generation of health services professionals. And we need to think more about how we can cross-train, how we can provide more interprofessional education. And I know we have a lot of interprofessional education with our pharmacy program, but not as much with genetics, because that's a more specialized area. But maybe that's one area that we can think about, is doing some cross-training in the interprofessional education where they're working on cases, and maybe they're working on a case that is genetics related. UPMC talked about their efforts in promoting patient and provider awareness using alternative service delivery models like telegenetics, and looking at patient satisfaction for them. And one of their areas, and I think that's been an opportunity for everyone, is to figure out reimbursement for genetic counselors and how we're going to pay. NIMAC talked about how we could improve health literacy in the community setting, and some efforts that they have ongoing in different parts of their region, which may not include Appalachia. And also helping families to follow up on recommendations. And that was a part of the project that Dr. Fala and I have been working on, trying to, mostly Dr. Fala and her group, trying to figure out how to get people to send those kits back in and to follow up. At Duquesne, Dr. Cronk talked about training nurses in genetic care provision. And so she's got a number of active programs in that area and invited people in our region to participate in that. So NIMAC also has telegenetics resources as well, and they have a training institute for the NIMAC region. And also, Dr. Cronk also suggested looking more at gene-environment interactions. And so Dr. Galvez just submitted a pharmacogenomics project to train pharmacists. So I think that will be helpful along those lines. At Georgetown, discussion on building community ties with Arboles Familiares is one of the programs that they're working on, and improving referrals and family history collection, which is an interest of mine as well, in how to collect family history information. So, do these represent the opportunities and resources in the Appalachian region? And certainly if you have other ideas, I would be happy for you to talk.
Dr. Kelly?
Yes.
Christy, I think this might be part of the resources mentioned in an indirect way across maybe most of the sites, but the idea of leveraging patient navigators or community health educators through those community ties, through raising awareness in other types of healthcare providers. I think the folks who are already being the bridges between our communities and our healthcare providers and the kind of referrals could be really well leveraged here in this type of genetics awareness raising and referral provision.
Yeah, I like that idea. We can do more community outreach in that way, and do some training on just family history collection. And I know some people in the Appalachian region have used churches as a way of reaching out, but so that those are some opportunities for us as well. And maybe working with the GMAP program. That's one that I didn't mention, but the GMAP may be interested in something like that. So. Okay, Dr. Galvez, did you have your hand raised?
Yes, Dr. Kelly, I was thrilled to hear about the interprofessional education because I was a member of the American Association of College of Pharmacy, and we have a SIG, a study group interest on pharmacogenomics. And I learned that actually in some schools, they are already doing some type of integration and collaboration where we have the genetic counselor and the pharmacist. So they learn from each other what a genetic counselor should be doing, what can a pharmacist can do with the medication and the condition of the different gene status of the patient. So University of North Dakota, Utah, and I'm more than happy to share with you some of the schools that are already doing that, and they are doing it at a higher level when the students are going in rotations on the P4 year, but also trying to do a little bit before that. So I would be more than happy to connect you with all of them. And the second question I have, or point, was when you were mentioning about gene environmental interactions. So basically it's like maybe more epigenetics. Actually, I see that it's not listed in that Appalachia region, but University of Cincinnati, the environmental health department, when I was there 15 years ago, between 2008 and 2012, we had a T32 training grant on gene environmental interactions. I could follow up with them and see if they are doing anything else, but we were studying all about how the environment actually is affecting how the genes behave. And they had so many resources because they were working through the Department of Environmental Health rather than through the NCI. So it was a little different, but I'm more than happy to share those resources with you all.
Yeah, that would be great. And University of Cincinnati also has a large Appalachian population.
Mm-hmm. Yes.
They're just right outside of Appalachia. Mm-hmm. And so, one of the things I've been, and, my patient interviews talk about this a lot, just pollution in the environment. Yes. And water pollution. Yes. I mean, and I was just sending an email this morning to the Friends of Blackwater, who, and I'm hoping that we'll get a policy statement from the Society of Behavioral Medicine, Health Equity and Inclusion group that, that we will talk about water quality for underserved populations. And I think I wonder about the genetic link. I mean, I know that arsenic, what was it? Dr. Hendricks was doing a fair bit of work, and last I heard he was in Indiana, but maybe we should reconnect with him. Yeah, there were a big research towards cadmium contamination because of the mines, as well as PFOA. Those are basically the compounds, polyfluorocarbonated compounds that are being used for Teflon, kind of the lining of your pants, so they don't become sticky. So actually, there was a factory in Kentucky, and there was an accident, so there was so much contamination on the waters. So they were looking at the impact on girls to have in early development. So you will start seeing how girls start having their first menses way earlier than the average. And so they were studying about that. So there is, I know that the director of the school, the environmental health department changed. But I can kind of follow up and see how are things. I don't know if the T32 has been renewed or not, but when I was there, it was there. Yeah, that's an important area, and it's something that weighs on the minds of a lot of our patients, I think. I asked for elevated cancer risk, why people thought they had elevated cancer risk, and the response I was expecting is like, oh, we need better access to screening facilities. What I didn't expect was all the stories about the environmental pollution that they witnessed, that these factories would be in the area and then they would close down, because it was no longer financially viable. And then they would just bury all their pollutants. So a very interesting angle on this issue, just people being at higher risk in general. Dr. Fala, I think you have your hand up.
Yeah, I just wanted to comment that recently we were found that there is a genetic assistant educational program that can help our staff to have some educational about coordinating testing and how they can be more of an assistant to the genetic providers or genetic counselor. I think that we have probably 4 of our staff now signed up for that educational program. And as you mentioned, Dr. Kelly, that we had some issues with genetic testing coordination and the completion rate was low. But having that in part where our genetic staff coordinator or genetic testing coordinator, the test coordination or the authorization could help improve completion rate and communicating with patients. We also now we have a genetic nurse association, genetic nurse education, which could be helpful to provide education to the nurses who are interested in providing genetic service, not just that are collaborators or part of the genetic department, but they could be part of NICU or PICU, where they will have the ability to coordinate testing and be able to communicate with the parents or with the patient in a much more effective way. So these resources could be helpful. Having access to these resources from the staff or from the nursing standpoint, these could also help implement the genetic service around the state and in places where genetic providers may not be accessible.
That's great. Do you know of the name of the genetic assistant program? Is it run out of a university or something?
Yeah, I believe it's in Maryland or Johns Hopkins. I will get that name and let you know. I think it's provided virtually or in person, and it you have to pay for that. So resources, funding opportunities, and things like that could help improve the access in general.
That's great. And I know Dr. Scott has been working on something similar for pharmacy, that there's a pharmacy tech program and that there's a whole credentialing process now for that. So I do wonder about credentialing for genetic assistance as well and what might be offered there in the future. But certainly that is a benefit to have people who are working in the genetics field that may not have that particular background, but who are able to gain knowledge, to understand more about the process. So that's great. I also had a nurse reach out to me from Huntington. I don't know if she's on this call, but she was interested, and she said that she would. I don't think she's on this call, but she was going back through our sessions to learn more about, and I think she's been connected with Dr. Nehramanchi. So that's great. You know, if we've reached one nurse that she was already working a little bit in prenatal, but was interested in really stepping up their program. So I'm excited about that. So lots of opportunities. Any other thoughts? So I heard the interprofessional education, gene environment, research that's currently being done, and leveraging patient navigators and community ties, which are a couple of other ways that we could approach this. And then offering additional training to people who aren't necessarily in this area.
Dr. Kelly, I put one other training course in the chat. That's
Okay.
available through City of Hope. That's for different types of healthcare providers too.
That one is a great one, and it's been in existence for a long time. And I didn't mention that. In the past, they've required, I think it was 1 week that you needed to go to the City of Hope and have an intensive training. And I believe that some of our PAs, our physician assistants here at WVU, have gone to that training, and it is very good. So as a part of our conference outcomes, we said that we would have 4. One was to have some reflection on the policy environment, also to talk about provider and patient resources, dissemination, and a research agenda. And so I'll talk a little bit about where we are in those. So, you know, I keep hoping that something will happen with this. There's been an initiative to consider genetic counselors as providers in the CMS system, and we're still not there. Pharmacy has also been going through a similar path. They seem now, with the COVID pandemic, they're probably a little bit closer now to receiving a provider status according to CMS. So these are kind of exciting developments, and we will maybe learn some things from the pharmacists about how we can better get compensation for these kinds of services. So that the one that has been sitting in the House for a while, I think, is HR 2144. I haven't heard of any more action on that. And if anyone else has heard anything, I'd be excited to hear about that. But, you know, it's a part of our challenge here, is getting genetic counselors compensated, or, you know, nurses at the bachelor's level. We do a little bit better with compensating PAs and NPs, but that's still a barrier. We talked a lot about different compensation models, and so you know, having having the remote location to provide some compensation. But there was a few different methods of doing that. And I know that Alyssa Terry had talked about some resources that they had in terms of compensation. Any other needed policy goals that we can think of that we might want to address? I think some of us aren't in a policy. Oh, Megan, if you have some thoughts.
Hey, yeah, I don't have, oh, sorry, I have you on two screens here because my speakers weren't working. So I don't have any information about policy goals. Goodness. But I do know that the HR 2144 bill is kind of gaining some momentum right now. And right now the NSGC is coordinating what they call their spring push to have genetic counselors meet with members of Congress. And I also recently received some literature from them about how our institution can help us, can help that initiative by signing their intent to support genetic counselors as healthcare providers. And we have also recently renewed our interest in going for state licensure again. I think it's been 3 years since anybody really tried to do that. And I don't think that the appropriate resources are really well utilized. So that's something that we're going to start working on again soon.
So how can we help?
That is a great question. I can forward you, well, it sounds like most of it is going to come from just like the institution as a whole right now. But as soon as I know more about what we can do, right now it's mainly just getting West Virginia or WVU Medicine to sign that this is something that they support. They'd be in good company like the Children's Hospital of Boston and many others. And then I think that is just like our first concrete step outside of trying to get people to meet with Congress, which I have to see. I think that anybody can do that, can sign up to. So I can forward you the email that I got from the coordinator.
So how can the Faculty Senate at WVU support this?
I wonder, so you mean from like the university end? Like instead of like I was going for it from like WVU Medicine, but I guess West Virginia University could also like sign this letter. That might be helpful.
So I'm the incoming chair of the Faculty Welfare Committee. And so if we can spin that, but there's been nothing on our agenda lately. Okay. I won't say nothing, but it's been a very low, we've had low volume lately. And so I can forward something along to the chair. And there's also a faculty governance committee that's within the Faculty Senate that, if I can help some way through that. But those are a couple of ways that we might leverage. And there's a legislative, Marina, do you know the name of it's the person that is the liaison between the university and the legislature?
I can send you the name.
Yeah, I have her name, but
yeah, I cannot think of it. I met her yesterday, but I cannot remember. I will say.
Yeah, I'm blanking because she, I ask questions every time because it's an interest of mine. But so we have that angle as well, and I know that our state representative from our region, Representative McKinley, is one of the co-sponsors on the pharmacy bill to support pharmacy licensure. And so we might be able to leverage that as well. But Megan, I'd be happy to speak to you more about these kinds of things and just talking to our state legislators and seeing if there's anything that we can do on that end.
So I'm going to forward what I have. It's under number 3, she links to the letter of support and a form that if we can get someone to sign it.
Okay. Okay. I think our next welfare committee is tomorrow, which I'll be traveling, but I can forward it along and try to listen into the session and explain it. But if there's anything in particular that I can say, so this is just at the state level, but we can talk more about that too. And have you talked to your faculty senators from the School of Medicine? Are they?
This is very new. We've mostly been talking with Amy Bush and her assistant.
Yeah, because I believe Dr. Dan Ellswick is one of your senators as well.
Okay.
And his wife is a pharmacist, and so may be sympathetic to our cause.
Yeah.
All right. Any other thoughts on policy goals? So state and federal. So this federal push, talking to our legislatures, and this may be something that we can send around to the different locations so that, maybe you can contact your federal members of Congress. Okay. How are we doing on time? Okay, we've got about 20 minutes. So in terms of patient and provider resources, some of the immediate ones that we identified were, of course, we have the website. So folks are still looking back at some of those sessions to see if something may be helpful to them or what they might learn about our area. We also talked about university-specific resources that people are doing, things like doing educational sessions for providers, also developing patient resources. We talked about NIMAC and ISONG as being a couple things. And so in terms of educational efforts, grand rounds, also Arboles Familiares, which would be a patient navigator, not a patient navigator, it would be more of a community-based type of intervention. Some of the nurse networks and training along with ISONG, there was mention of the ONSEN and the G2NA as these networks that would be helpful. And also Dr. Cronk mentioned some of her efforts in training nurses in genetics. There were different clinic types that folks were trying to leverage in terms of multidisciplinary clinics, which is usually more relevant to pediatric, but I know like things like Huntington disease also benefit. So there's some effort there to kind of leverage a larger group of people and become more familiar with genetic issues. Some specialty clinics, cancer is one, outreach into the community, which was our traditional way of reaching the community. And also this idea of leveraging regional networks, having smaller facilities pair with larger facilities. And I think, in West Virginia, the situation is that WVU has been buying up a lot of smaller hospitals because in a NCI meeting, I guess it's been about 3 or 4 years ago, they were talking about the dramatic loss of our regional hospital, our small community rural hospitals, that we were losing a lot of those healthcare centers. And so the effort in West Virginia, I think, with the medical system here is that the university has been buying up a lot of those smaller hospitals to have satellites. And so I know that the similar situation has been established with the University of Kentucky to reach out into Eastern Kentucky, which has a large rural population. So are there resources that we need to develop?
Dr. Kelly, I'm not sure if this falls under the patient-facing education, but some of the kind of patient advocacy and patient education type groups like FORCE, Facing Our Risk of Cancer Empowered, have really done a great job developing educational materials, videos, interpretation of some of the science, interpretation of some of the headlines. And I believe that they're also working on some health literacy and genomic literacy educational modules. So maybe partnering with existing groups that have already done a deep dive into some of the work and then tailoring that for different communities or audiences or topics could be one to, save costs of developing something from scratch, and then also expand the reach of those community and patient advocacy type groups.
Yeah, and maybe it's just a perception of mine, and I'm sure this is wrong, but I always had the perception, and I follow them on Facebook. I follow Force. I always had the impression that they were more active in the Northeast, but I know that they're a national group, but so I'd be interested if they had any kind of like rural health kind of resources, and that's just ignorance on my part because I'm not as familiar with them.
Yeah, I think their headquarters is in Florida, which I was surprised to learn.
I'm totally off.
And I know that they've presented at some national organizations too. I can't speak to their rural health focus, but I know that they're very interested in partnering with different groups to develop and leverage, what they've already done and tailor that. So that
sounds like a great group. And I know I appreciate their work. I just haven't been as familiar with it lately. I just basically see what they put out on blast on their Facebook sites. And I know they do a lot of what they had some kind of informational videos or things that they were showing. And so, yeah, if it's something that they have that's existing and maybe not tailored to our population, maybe we could modify it in some way to make it more relevant. That's a good idea. Any other thoughts about resources? I mean, one thing that we could think about is just kind of developing patient resources that we can share amongst kind of our population and kind of house them in one area. If there are particular types of education, it seems like a big, a heavy lift. I mean, it seems like, we might do individual conditions and maybe put together something like that. And it sounds like Dr. Cronk would have interest in Fragile X, for example. But how do we deal with this larger issue of just genetics literacy in general? I think the community building way is very helpful in one sense, and then educating the providers in another. And that's one thing that we had talked with Alyssa about pairing with NAMAC to work on. Dissemination, we have a website. We are planning to put together a manuscript looking through so I appreciate if you all can fill out the evaluation at the end so that we can have more information about what your feelings are now. And also think about other locations that we may want to talk to. And it sounds like, from a policy angle, maybe we do need to do some education of our legislators. And I did invite Barbara Fleischhauer to attend, and she's a local delegate for West Virginia and is running for Senate in West Virginia, so our state legislature. And I know that this is an issue that's relevant to her family, and so I hope to hear more about her involvement and engagement in the future. But as it stands, I think that she's had some conflicts. But hopefully that will be a area where we can do some education as well. So as far as the research agenda, what is our next step? So from what I'm hearing is we need to think more about maybe thinking of some kind of patient navigation and community-based research where we're using lay health educators or lay health advisors. And I'm probably used the wrong term. I know that there's one that is a specific training and one is a more general term, but to leverage those, considering interpersonal education, looking at gene environmental interactions, getting more information about the genetic assistant program, finding out more about the spring push from the NSGC and state licensure, and also possibly reaching out to groups like FORCE to see if there may be some more patient information. Okay, any other thoughts before we adjourn? It sounds like a pretty good area for us. Again, we've also been trying to do a little work in education on pharmacogenomics. And so that's one area we have going. And also in kind of getting response back and from patients and getting them to send back their kits once they get out.
I'm not sure if this would fall into one of the buckets of research ideas you just talked about, but one thing that I'm really curious about is the idea of once someone in a family has a genetic test, and if they test positive, how do we support them and or make sure that others in their family, so the cascade testing question and the family communication question. And I think that might differ based on different patterns of communication in family about health information, and who's the gatekeeper, and do people talk about these things or not? And so I think that could be an interesting question.
Yeah, that's a huge interest of mine. And when I was at Ohio State, they had identified colon cancer mutation that they thought was originated in the United States. And so there was a lot of work with that, trying to identify the families and look at how that might have been transmitted. But certainly that communication and families are pretty tight here. So that's one advantage we have. So the network is strong. The network is very strong, but the way that information is communicated may be challenging.
Yeah.
And so how do we help people who don't have a genetics background to understand how to communicate this to other people? Yeah.
Right.
So that's more on the identification end of people at risk.
Right.
Yeah, which also goes into like helping the providers as well, provider education. So and I've also seen in my research, talking to one woman, that she said, my mother had early onset breast cancer. I went and I talked to my physician and he told me not to worry about it.
Right.
When she was concerned and she was probably within that 10-year time frame, it wouldn't have hurt to have a baseline mammogram. And so, I kind of stepped a little bit out of my research shoes in that sense. And I said, well, sometimes we're our own best advocate. And, if you're not satisfied with the quality of your care, then, there's always the option of getting a second opinion. So that's a little tricky. So when other family members are identified, what do they do next? But so having patient activation, I think is very helpful.
Yeah.
All right. So again, I appreciate your all's engagement throughout the sessions, and for those who are viewing later, we appreciate you reviewing our materials. And to wrap up, we would appreciate you completing this final evaluation to give us more input about how we might address these concerns. And I haven't checked the chat. Is anything coming up? Okay. Okay. All right, so there are a lot of links in there. And so hopefully Anusha and Trupti can copy those for us, and maybe we can distribute them along with our follow-up email. Any final questions or comments? Well, great. It's been such a pleasure doing this, and I really had no idea how this would go, but I appreciate you all hanging in there and contributing and wanting to help with this challenging issue. And I think to some level we're all experiencing it, but in Appalachia it's pretty challenging. So thanks again.